Hello and welcome to this massive open online course, Introduction to Biorisk Management. I am your instructor Kenneth, and in this module we will be focusing on the management of clinical samples. Clinical samples are samples derived from hospital patients, and these are analyzed routinely in hospital laboratories or in specifically designated pathological laboratories. The objectives of this module are to introduce you to the different types of clinical samples, to understand the various processes involved in analyzing clinical samples, to assess the risk posed during the processing of clinical samples, to identify pertinent controls for the mitigation of the risks, and to understand the implications for biosecurity management of clinical samples. The learning outcomes for this module are as follows. Upon completion of this module, you should be able to describe the various types of clinical samples, describe the process involved in the diagnosis of microbial, serological, and nucleic acid samples, apply the pertinent controls to mitigate the risk posed by processing of clinical samples, and describe the management of the security aspects of sample analysis. Clinical samples can present themselves in many ways. They can be in the form of blood, serum, swabs, stool, urine, body fluids, or biopsies. Risk assessment for clinical samples has to take the following facts into consideration. The first fact is that the clinical sample may consist of multiple biological agents derived from a single patient. In this case, the risk group will be unknown, and it is advisable to assume the highest risk group. One of the ways in which you can obtain information about the sample is by referring to the sample collection sheet. This will offer an insight into the case history of the patient as well as his or her current status. Take note that some of the patients may be asymptomatic carriers and may not manifest any of the clinical symptoms which are associated with a specific biological agent. In some cases, the sample may be transported or dissolved in a specific chemical or reagent. In this case, we must refer to the material safety data sheets which will accompany the samples. Sample processing. There are 4 diagnostic procedures which can be associated with the processing of clinical isolates. The first procedure may involve microbial isolation and culture. In this case, the laboratory technician will perform a serial dilution of the sample and culture the biological agent on a selective medium or isolate DNA directly from the sample itself. The second diagnostic procedure involves serological tests such as enzyme-linked immunosorbent assays in order to determine the interaction between antigens and antibodies. The third procedure may involve nucleic acid extraction and polymerase chain reaction in order to analyze viral DNA and RNA from patient samples. And the fourth procedure may involve microscopy of the sample. Risk mitigation is generally applied to mitigate or reduce the risk posed by the biological agent. The first step in risk mitigations involves the transport chain. The sample will generally be transported from the hospital or collection center via the transport network. You must ensure that the sample is packaged appropriately. the sample is clearly labeled. Absorbent material is included in the sample packaging to absorb any of the spills which may occur during transit. Adequate cooling agents such as dry ice or ice packs must be shipped with the sample in order to maintain its integrity. The usage of ice flakes is not recommended, as this may be prone to contamination. Personnel such as drivers and couriers must be trained in sample transport and must be aware of the risk posed by the biological agent contained within the sample. This is one of the symbols which are generally labeled onto samples. This is the symbol for biohazard. Risk mitigation and sample documentation. All samples must be documented upon receipt in both an electronic and handwritten format. Samples may be assigned specific codes in order to protect the identity of the patient. Documents associated with the sample must be stored in secure locations, or if it is electronic data, it must be stored on secure servers. Inventory management is essential in the event that the samples are archived. Risk mitigation for sample culture. Microbial samples derived from bacterioviruses may be cultured in appropriate media. The risk assessment must be conducted for exenic cultures based on the specific risk group. Some samples may have specific risks associated with them, such as the ability to produce spores or be dispersed via aerosols. The judicious use of controls is required in order to mitigate the risk posed by microbes. Risk mitigation for serological procedures. Serological procedures may involve the use of centrifugation for the recovery of serum. This must be done within a biosafety level 2, BSL-2, or a biosafety level 3 laboratory. Certain procedures, such as samples derived from patients infected with risk group 4 pathogens, may need to be done in a BSL-4 facility in order to limit the risk of exposure of the laboratory workers and the environment to the biological agent. One of the key aspects of sample management involves the processing of waste after the sample has been analyzed. All laboratory waste derived from the process of clinical samples must be treated as hazardous. Waste should be labeled appropriately and catalogued. Waste must be autoclaved except for specific volatile or corrosive substances which may necessitate special decontamination procedures. Biological waste may also be incinerated after autoclaving. Generally, laboratories appoint a specialized company to manage biological waste after decontamination at the facility. Performance assessment. Performance can be assessed at the facility by analysis of the incident and accident reports. Baseline monitoring of serum of the laboratory personnel will also provide an indication of the degree of risk mitigation. Procedural audits based on observation of the personnel by the biosafety officer or an independent auditor also provide the relevant assessment of performance. Reporting of incidents. All incidents must be reported to the biosafety officer. Appropriate documentation of the incident in a specific form is necessary in order to ensure traceability. Identification of the root cause of the incident is essential in order to prevent recurrence of that particular incident. Revision of the standard operating procedure is required in order to prevent the same incident from recurring. Reporting of accidents. Accidents pose a serious threat to personnel as well as the operation of the laboratory facility. All accidents must be reported to the laboratory management. The management will be required to report an accident to the local authorities in order to facilitate investigation. Identification of the causative factors and the controls which can be applied to mitigate the risk of accidents is essential in order to prevent recurrence of these accidents. Data security. Clinical samples involve the management of patient data. All data must be kept confidential. Employees must be required to sign a non-disclosure agreement. Data must be secured electronically. All printed documents must be stored securely as controlled documents. Copies of documents or data must not be made prior to obtaining written authorization. Inventory management. Patient samples must be stored for future detailed analysis. The samples must be stored under the appropriate conditions. Physical security must be maintained. Inventory management is essential in order to ensure traceability of samples. Compliance with specific standards. Your respective organization may be required to comply with specific national and local regulations. Please refer to these laws and regulations when developing your biosafety manual. A general document for reference is the CWA 15793, also known as the SEN Workshop Agreement on Laboratory Biorisk Management. I will be covering this in another tutorial on laboratory biorisk management. To summarize, this module was designed and developed to introduce you to the basic guidelines in the management of clinical samples. You will have to develop specific procedures for biorisk management based on your organizational procedures and in compliance with local standards. Thank you very much for participating in this module. Stay biosafe.